Hi, this is Dr. Shohini.
Hi, this is Dr. Ayush.
So today we are going to discuss about a medicine that is very commonly prescribed in psychiatry, that is olanzapine.
Yeah, so olanzapine, as we know, is a atypical antipsychotic and it is very commonly used medication in psychiatry practices, and we'll be talking further more about this medication.
So Dr. Ayush, what kind of drug is this olanzapine?
So thank you, Dr. Shoini, for the question. So olanzapine, it's a atypical antipsychotic, also known as second generation antipsychotics. And these medications, they work by balancing neurochemicals such as serotonin and dopamine.
Okay.
And by working it, it reduces certain symptoms which are used in psychiatric practices.
Right. So how does this medicine work?
So olanzapine, it blocks certain receptors in the brain, and by blocking certain receptors in the brain, it balances out certain neurochemicals, which are mainly serotonin and dopamine. And by balancing out these deranged chemicals, which happen in many of the condition, it causes a decrease in those symptoms which are causing problem to the patient.
Okay. Now what are the indications of this medicine? When is it prescribed to a patient?
So it has various indications. Most commonly, it's an antipsychotic medication. So it is used in psychosis. For example, schizophrenia, persistent delusional disorder, acute transient psychotic disorder, psychosis not otherwise specified. However, olanzapine, one of the additional benefits is that it has some mood stabilizing properties as well. So not only in psychosis, it is also used in mood disorders such as bipolar disorder. It can also be combined with other antidepressants. For example, it can be combined with fluoxetine to form an OFC, that is olanzapine fluoxetine combination, which is very helpful in bipolar depression.
Okay.
And olanzapine, one of the additional benefits is it is a very safe drug in pregnancy. So in cases like postpartum psychosis also, olanzapine is used and is relatively safer.
Okay. So now let's address the elephant in the room, right? So anytime we prescribe a medicine to any patient, the patient or the caregiver, the main concern they have is what are the side effects this medicine will cause.
Yes.
So please elaborate on that for us.
So like any medication, olanzapine also carries side effect. For example, if you say paracetamol also, that also carries certain side effects like acidity, gastritis. So no drug is ever 100% free of any side effect. However, the side effects which olanzapine causes, they are very well manageable, they are treatable and they are reversible. And the incidence of side effects with olanzapine is also very rare. Research shows that it is less than 1 in 100 people. So it's a relatively safe drug. However, certain individuals can develop some side effects. For example, they can develop drowsiness, sedation, they can develop dryness of the mouth, weight gain, and sleepiness, etc. That can occur. But however, these symptoms are very manageable and it's not an indication to discontinue medication because they can be managed very easily.
Right. So please make a note of this. You might get these some minor side effects, but it's not an indication for you to stop the medication. You should consult your psychiatrist and they will manage the side effects. So now just tell us that is there any serious complication that one should be aware of?
Yeah, I'm happy that you brought out this question. Yes, olanzapine can carry certain serious side effects also. However, as I have told, the normal side effect is less than 1 in 100. Serious side effects are even more rare. However, we should always keep in mind olanzapine can cause certain serious side effects, which can be sudden onset of fever can occur, which we call it as neuroleptic malignant syndrome. Very rare, but it can happen. It can cause tremors, it can cause stiffness, and it can cause shoot up in the blood sugar level, cholesterol levels, metabolic syndromes. So these things are little serious side effects, and for these things if happen and the serious side effects happen, in that case you should consult a psychiatrist immediately because dose adjustment, possibly discontinuation of the drug might be needed in these conditions.
Okay. So in this medication, what are the formulations that's available for this?
Yes. So various formulations are available internationally also as well as in India. So we can categorize the formulations in two types. One are the oral tablets, the other one are injectables. Now oral tablets also we can divide it into two categories. One are normal oral preparations or tablets, the other one are melt in your mouth or dispersible tablets. So there are certain brands available of oral formulations. For example, Oleans is there, Olinstab is there, then Olana is there. These are the oral tablets and they are available in various strengths like 2.5 mg, 5 mg, 7.5 mg, 10 mg, 15 mg and 20 mg as well. So usually these are taken once in a day or sometimes twice in a day as prescribed by your psychiatrist. The other one are melt in your mouth or dispersible preparations. So these preparations are, you put them inside your mouth and they melt. Mostly it is used for those individuals who cannot swallow, have difficulty in swallowing. So they are also dispersible formulations. Their brands are also available. For example, Oli Melt, then Olana DT is there, Zyprexa Metlab is there. So these are all melt in your mouth preparations.
Okay.
Now, if we talk about injectable preparation, so it is also available in injectable form, which can be either short-acting injectable or long-acting injectable. Short-acting injectable are usually used in crisis or emergency setting. For example, a patient has become very violent, sudden aggression, anger outbursts are there. So give that injection to settle the patient down. So, for example, Olean Z is a 10 milligram short-acting injectable which is given intramuscularly. So that can be used in these crisis emergency settings. Then Zyprexa injection is there, that can be used. So these are the injections which can be used, 10 milligram injection.
Right.
The other one are long-acting injectable which are given once in 2 to 4 weeks under the supervision of psychiatrist. These are depot formulations, you give it and then they will keep on releasing olanzapine for a sustained period of time, and once in 2 to 4 months it can be given. The most common brand which is available in India is Tolaz LA, that is Tolaz long-acting injectable, usually available in the strength of 300 and 405 mg, given every 2 to 4 weeks under supervision.
Right. What are the indications for these long-acting injectables? When should we prescribe it to a patient?
Yes, so long-acting injectable should be given when compliance is an issue. So compliance means patient is not able to take medication, skips most of the time, there is complete irregularity. In that case, it also becomes very difficult for caregiver to always maintain a schedule, routine when to give the medication. Most of the time he ends up skipping it. So in that case, once in every 2 to 4 weeks, one injection of either 300 or 405 mg can be given, and then it becomes much more convenient rather than taking every day, once in 2 to 4 weeks. So in that cases, long-acting injectable can be used.
Okay, that's nice. Like what happens if a patient misses a tablet, misses a dose? What should he do?
Okay, so if he misses by few hours, for example, he had to take it 1 to 2 hours before but he missed it. In that case, it doesn't create any problem. It can be taken at that time.
Right.
And if the person has skipped a medication and the next dose is very nearby, so in that case, do not repeat the past missed dose, just take the dose which is pending. However, if multiple doses are missed, do not self-medicate, do not self-adjust the dosage by yourself, consult a psychiatrist, tell them about those missed doses, and then only according to the advice given to you, restarting of the medication may be needed. But always consult a psychiatrist, never do self-medication or self-adjusting of doses.
Kindly take a note of this. This is a very important information that everybody needs to know. Please do not self-adjust your medications. Okay. So lastly, tell us, like, when a patient is or a person is already on olanzapine, when should they visit a consultant or when should they visit a psychiatrist?
Yes, very rightly said. So it's a very big issue, and like it is one of the most problematic issues. Even when patient is on antipsychotic, there can be certain condition, for example, sudden worsening of symptom. The patient is saying that hallucinations have increased. You can see cross-sectionally patient has become very violent, agitated, sudden anger outbursts are happening. Or for example, serious side effects that I have already told, like uncontrolled fever, uncontrolled sugar spikes are there. So in all these emergency conditions, it is advised to stop the medication and visit the emergency settings immediately. So these are the things which has to be taken care of, and caregiver should also make a note of all these symptoms which can be in the form of crisis or which can be in the form of serious side effect. In that case, consult the psychiatrist.
Okay. Thank you, Dr. Ayush, for this wonderful session we had on this drug called olanzapine. We got to learn a lot about this drug and what all we should be aware of, especially the patients and the caregivers who are taking this medication. Any other tip that you want to give before we close this session, Dr. Ayush?
Yeah, first of all, thank you, Dr. Shohini. There is one tip, like a tip for caregiver, which I would like to keep. So the thing is, olanzapine, like it can be a very high burden for the caregivers and family members in which the patients are suffering from psychiatric illness. So I always encourage to keep an open communication. Do not create a stigma regarding that, and always keep these medications, always give them under supervision. Keep them away from the patient at all times, and just always create an open communication between the caregiver and the patient. Make sure that regular follow-ups are done and compliance has been maintained. And then it is a condition which hampers the individual. However, with the right direction and right support, these conditions can be managed easily.
Right. Thank you.